Disorders of the female reproductive system, PCOS. Polycystic ovary syndrome has no known etiology, but researchers have linked it to excessive insulin production. Excessive insulin in the body can release extra male hormones in women. Since the ovaries produce high levels of androgens, this causes the eggs to develop into cysts, and instead of releasing during ovulation, the cysts build up and enlarge. The most common symptoms of PCOS include oligomenorrhea, amenorrhea, polymenorrhea, enlarged ovaries with multiple small painless cysts or follicles that form in the ovary, acrocorduns, acanthosis nigricans, hirsutism, thinning hair, acne, weight gain, anxiety, depression, hyperglycemia, and infertility. Treatments like medications such as birth control pills or anti-androgens can help balance the hormones in your body and relieve some of the symptoms. STIs, or sexually transmitted infections. The terms for STIs, or sexually transmitted infections, and STDs, sexually transmitted diseases, are often used interchangeably. Sexually transmitted diseases, or STD, implies the disease was acquired through sexual transmission. A disease is a disorder of structure or function in a human which produces specific signs or symptoms. A disease must be managed, as with the case of human immunodeficiency virus, which can also be acquired through the transmission of other bodily fluids. The treatment may include antiretrovirals or antivirals. Chlamydia, or CT. Chlamydia is one of the most common sexually transmitted infections caused by bacteria that infect the cervix, urethra, and other reproductive organs. Chlamydia is easy to treat and can be cured. Many people with chlamydia do not have any symptoms and unknowingly pass the infection to their sexual partners. If symptoms develop, they usually appear 2 to 6 weeks after sexual contact with an infected person. While females are most often asymptomatic, they may experience cervicitis. Left untreated, chlamydia in females can lead to pelvic inflammatory disease, or PID, which can cause permanent damage to the reproductive organs and subsequent infertility. Chlamydia spreads through unprotected sexual intercourse with an infected person. Chlamydia can be spread to the eyes via the hands with direct contact of infected fluids. Until a patient finishes their treatment, they continue to have the infection and can continue to pass it to others. Chlamydia is treated with antibiotic pills. If the patient has epididymitis, they may need to be hospitalized and be treated with intravenous or IV antibiotics. All sexual partners within the past 60 days should be examined, treated, and informed that having no symptoms does not mean there is no infection. Gonorrhea, or GC. Gonorrhea is a sexually transmitted infection caused by bacteria that infects the cervix, urethra, and other reproductive organs. Infections can also infect the throat. Gonorrhea can be treated and cured. Many people infected with gonorrhea have no symptoms and can unknowingly pass the infection on to their sexual partner. If symptoms developed, they may appear 2 to 7 days after sexual contact with an infected person. Symptoms vary depending on which part of the body is infected. Females may experience abnormal vaginal bleeding, discharge, or dysuria. Left untreated, gonorrhea in females may lead to pelvic inflammatory disease and fertility complications such as ectopic pregnancies. Gonorrhea infection may lead to sore throat and swollen glands. Gonorrhea infection can cause itchiness and discharge. It is spread through unprotected sex with an infected person. Until the patient finishes their treatment, they continue to have the infection and can pass it to others. Gonorrhea is treated with oral antibiotics in combination with an intramuscular injection. It is important that one completes the treatment and abstain from unprotected sexual activity for at least 7 days following treatment. All sexual partners within the past 60 days should be examined, treated, and informed that having no symptoms does not mean there is no infection. Both chlamydia and gonorrhea are reportable diseases. Therefore, local health departments will be willing to call the doctor's office or patient to ensure correct treatment was received and sexual partners have been followed up with testing and treatment. Human papillomavirus, or HPV. HPV is a common sexually transmitted infection. Both males and females can be infected with HPV. Almost 3/4 of sexually active individuals have been exposed to HPV in their lifetime. There are over 100 strains of HPV, and some strains of HPV can cause visible genital warts. The warts are usually painless but may be itchy, uncomfortable, and hard to treat. Some strains of HPV may cause cancers. HPV spreads through sexual activity and skin-to-skin contact with an infected person. Since some people are asymptomatic, they don't know they have the virus and consequently pass the virus to their sexual partners. Treatments are available for genital warts, but there is no cure for HPV. The HPV vaccine, a vaccine called Gardasil, is available for 9 HPV strains. This vaccine assists the immune system in protecting the body against infections and diseases caused by HPV. Herpes simplex virus, or HSV. Genital herpes is a sexually transmitted infection that is caused by a virus called herpes simplex virus, or HSV. There are 2 types of herpes simplex viruses. Type 1 is oral herpes or cold sores caused by HSV-1, and type 2 is genital herpes caused by HSV-2. These viruses are very similar, and either type can cause genital herpes or cold sores. Symptoms might include dysuria, enlarged glands, myalgia, arthralgia, and fever. Once a patient is infected with HSV, the virus remains in their body even after the symptoms are gone and can cause recurring outbreaks. Between the outbreaks, the virus stays in their body. When the virus becomes active again, the symptoms return but are usually less painful and heal faster. Recurring outbreaks vary from person to person. However, they can be triggered by emotional or physical stress, exposure to sunlight, hormonal changes, poor nutrition, sexual intercourse, lack of sleep, or low immune system. Herpes is spread through direct contact with the sores or blisters of an infected person. Contact and transfer of the virus can occur from genitals. Herpes can also be passed. Herpes spreads easily during sexual contact while symptoms are present or just before an outbreak of symptoms. An infected person may spread herpes even when they have no symptoms. This is called asymptomatic shedding. One can spread herpes virus to another parts of their body after touching the sores. Auto-inoculation. The fingers, eyes, and other body areas can accidentally become infected in this way. Hand washing after touching sores and blisters is recommended to prevent spreading the virus. There is no cure for herpes. Antiviral pills help to reduce symptoms and speed the healing of blisters or sores and are prescribed by a doctor. Treatment of symptoms may be managed with medication for pain, bath salts, cold compresses, and urinating in water may help to relieve discomfort. Keep the infected area clean and dry. Wear cotton underwear and loose clothing to reduce discomfort. The only way to reduce the risk of transmission of herpes is to avoid direct contact with the sores and to use condoms. Condoms will reduce but not eliminate risk, as the virus can be present and shed from the skin in the genital area.